how likely is it that the state would be able to cover the $200 million a year to keep the Medicaid expansion, the $8 million a year you just talked about for public health, and if so, where would that money come from?
So I really hope it doesn't come to that, because I don't know where we would find the money, or if we could find the money at the state level. I will pledge to do everything I can to, do as much as we can. But the purpose of today, and what we need to do first, is make sure that Trumpcare doesn't become a reality, because, as you know, on a $3+ billion budget, $200 million is blows a hole through our budget. So I pledge to do everything that I can to do that. The same with the health exchange. I want the health exchange. It's working. The Affordable Care Act is working in Rhode Island. So what we need to do is make sure that this doesn't happen. And that's, the focus of where we are now.
Is there anything you can do politically beyond what you've done, or reach out to Republicans, or what do you think?
I think, you continue to do what we're doing. Our federal delegation is hard at work. We're tough with them, and they're terrific. You raise awareness through events like today. I was with the president and his cabinet a few weeks ago in Washington. I was crystal clear that the Affordable Care Act works in Rhode Island, and 110,000 lives are in the balance here. So I've talked to my Republican governors around the country, many of whom have many constituents in their states will be hurt. But like I talked about the opioid problem. The overdose crisis is, in Rhode Island, probably the biggest public health crisis we face. That is true in many states. I was recently talking to the governor of Ohio. Major problem there. If Medicaid expansion is undone, whether it's in Rhode Island or Ohio, lives will be lost needlessly. So I'm lobbying my Republican governors all around the country to say, speak up, this is wrong. Speak up, this is way past politics. Speak up to save lives and do the right thing. And so, we're going at it in every way that we know how.
It's an open question. There's may or may not vote on this today. It's an open question whether they'll have the votes.
Right.
What do you take from this apparent internal debate among Republicans?
Of course I'm pleased with it, because I hope it doesn't pass, and that's why we're here today, to make as much noise as we can in order to prevent that from happening. This is going to hurt millions of Americans in blue states and red states. And it's time for Americans to unite and find a bipartisan solution to save lives. And I am hopeful that the fact that they're struggling so much to get the votes behind a new package gives us a glimmer of hope that they'll do the right thing and, not break a program that's working.
If this does pass and you had to backfill $220 million a year ultimately to keep Medicaid expansion where it is, would that jeopardize other programs that you are championing, such as the car tax or college education?
If Trumpcare passes, everything's at risk. If Trumpcare passes, everything's at risk. So the answer to your question is yes, and. Funding for education and social services, cuts and other good taxes, it's hundreds of millions of dollars. You know the budget as well as anyone. It's an unsustainable blow to our budget.
The president doesn't sound as though he's going to come off of his position, which is Obamacare was the worst thing and must be killed and done away with altogether, and come up with something new. It doesn't sound like he's going to get off that.
Right, so let me say this. As I said, I care about Rhode Island. Really, what do I care about? The people of Rhode Island. In Rhode Island, the Affordable Care Act is a great success. We have 96% of people are covered. the exchange is working, premiums on the exchange are flat or going down, we have a dozen plus options on the exchange. It isn't perfect, but by and large it's working. That isn't the case in every state. You know, to be honest about it, that is not the case in every state. Some states they're seeing premiums go through the roof. Some states there's no options on the exchange. So I do think it's, you know, fair to say that changes can and should be made to improve the Affordable Care Act. But that's not what this is about. And that's an okay approach. If the approach is to say millions of Americans have health insurance who didn't, and they deserve that, and we're going to continue that, so their lives will be saved and they'll be healthier, but we want to make some tweaks to bring down costs and increase choice, that's a big debate to have. That's a rational, good, governing thing to do. But that's not what's happening now. What's happening now is an immoral, wrong, reckless political approach to destroy the Affordable Care Act for political reasons, risking the lives of millions of people in the process, all in the name of giving a big tax break to millionaires and billionaires. And that is wrong, and it is un-American, and it'll hurt this country, and it'll hurt the people of Rhode Island. And I think it's time that we shouldn't do that. We, the people of America and Rhode Island, shouldn't allow that.
Governor, you say it's been working well in Rhode Island. What factors do you attribute to that?
It's great people who do all this hard work, you know. I mean, the health exchange is working. We have a health insurance commissioner who's really done an excellent job on cost. General Assembly has certainly played its role in providing funding for the exchange and working with us on Medicaid. People in Rhode Island who have come forth and said, I want to take care of myself, I want to be healthy, I'm going to do everything I can to do that. And then the Affordable Care Act it was a landmark piece of legislation that it just expanded coverage for a lot of people. You know, as I say, 110,000 people. Like, at the end of the day, you can't get away from the basic facts, which is, this is the federal government spending more money to insure Americans. I think that's a good thing. And the fact that they did that means folks have coverage that didn't.
That's what